Can you hit white balance for me? Hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Go ahead and try again. It's not. Okay, I think we're good. So you're laying on your side, your arms up in the air. So this is your biceps tendon here, the long head of the biceps. Just for orientation, if we were just standing behind you and you were standing up, your shoulder, this is your right shoulder, it would look like this. There's the glenoid, the shoulder, humeral head's coming off to the right there, but you're laying on your side, left side down, and so this is what it looks like. So this is the long head of the biceps. As we look at the anchor, we can see there's some laxity here, so this is what we call a type 2 slap lesion. You can see why just injecting this with a liquid, whether it's PRP or stem cells or whatever, is not going to stabilize this, because we've got to take off some cartilage here to reattach it back to the bone down here. So we're going to show you what that means. But anytime there's a legitimate type 2 slap lesion that's loose, we can stabilize that arthroscopically, and we'll show you how we do that. That is a very common injury to have in association with the Bankart injury that you have from these recurrent shoulder dislocations. So as we look towards the back of your shoulder, we'll show you some more in just a sec. Okay, so now we're looking towards the back of your shoulder. This is the posterior capsule. Lift straight up if you can. You can see this posterior labrum's not in great shape. We can see the Hill-Sachs lesion on the humeral head right there from the recurrent dislocations. And then we'll come back up here, we'll look at the rotator cuff. The rotator cuff looks good at the top of the screen here. We'll look down the front of the shoulder. And this is the injury to the front of the shoulder where this labrum here is significantly medialized and peeled off the front, all down here. So we've got a lot of work to do. We're going to start doing things in a stepwise fashion here, but I think now we've seen pretty much everything that encompasses the injury that you've got. So we'll go off on the video, show you some more in just a minute. Okay, so now we're looking from the front to the back. The camera is in the portal that we call the anterior superior portal. The shaver that you see is coming in from the back of the shoulder. And we're just starting to get a really good assessment of this Hill-Sachs lesion, which is the injury to the humeral head on the left here. Got a pretty good sized Hill-Sachs lesion. Down below that is the posterior labral tear down here. So our choices are to put an anchor down here and repair that, and hope that that Hill-Sachs lesion doesn't engage on the anterior glenoid, or we can do something a little bit more involved called a Remplissage procedure, which is where we put an anchor actually into the Hill-Sachs defect and repair the posterior capsule into it. As we look at the anterior glenoid, there's our central soft spot. You got a little bit of loss of cartilage there. But as we look at this, you have lost a little bit of bone off the anterior inferior glenoid, so we are, I think, going to go ahead and plan on doing the Remplissage. We'll prepare the area with our shaver, just like you see here. Then we'll take that black-handled rasp. Sorry. And we'll use this just to make sure that this is going to be a good foundation for healing here. This is why it's always important to have a look before we charge in and start doing things, because sometimes there's a little more damage than we expect. Sometimes there's a little bit less too, but either way, we can fix this all arthroscopically. So we're just using this instrument, as you see here, just to roughen this up a bit. We're not really trying to remove any bone, and so the next step is going to be to go ahead and take our shaver We'll be using that guide for the Why Not RC in just a second here. Okay, here we go. Okay, and so now we're going to plan on placing a suture anchor. This suture anchor is the same one that we use for rotator cuff repair, because really what we're doing is repairing the posterior capsule and infraspinatus tendon into this defect. So as we look here, I'm going to try and get this located where I'd like it. Okay, so we've got our guide in. Next we'll take our suture anchor, and then we'll take a mallet. It feels like it's down. We'll unload the anchor. We'll pull back on the anchor just to make sure. Oh, there we go. Just to make sure it's seated. And you can see a couple things. One is you can see the anchor is well seated. The other thing, look what happens when we pull back. See how we can take the humeral head that right now is anteriorly subluxated, and we can pull it back so it's centered over the glenoid there. So that's why we're doing this, adding this extra step to help us keep the ball centered in the socket. So now the next step is to go ahead and do some suture management. We're going to make sure this blue cannula is in right there. And we're going to pass these sutures one at a time. We'll show you that in just a minute. Okay, so we've got a black and white striped suture going into the anterior blue cannula. Now we're going to take a spinal needle and just plan on where we'd like to place some sutures. That looks like a good first stitch for inferior. You can see it's about even with the posterior extent of the heel sacks there. I can maybe cheat just a little bit more posterior. About like that. That looks pretty good there. So next we'll make a little nick in the skin and show you some more. Okay, so here you can see the relay coming through. Hold the camera there. We'll take a grasper and retrieve it. Just kind of hand it over here to the front of the shoulder. And now, can you reach that, Vern, to load it? We'll go ahead and load that with the suture. See right there? Okay, here you can see this relay has a loop in it. It allows us to bring it back through. I use this because it's the smallest device I can have, or I can use to pass suture through without making any holes in this thin posterior capsule. So now that's the first stitch. We're going to do a mattress type stitch, so we'll show you some more in a little bit. It's going to be the same technique 3 more times. Okay, so there's the first mattress stitch. You can see the black and white suture. We're going to do the same thing with another suture here. Crochet first, or pincher, I'm sorry. So I'm going to show you what it looks like there. Okay, so we've got two overlapping mattress sutures. Um, pull, pull that out. Just pull one of them, and that looks good. We're going to go ahead and take out the third suture that we don't want to use right now. But see, we've got two overlapping mattress sutures. Each one's passed through a separate incision on the posterolateral shoulder. And when we tie those, it's going to bring back that humeral head just like that. So now we're going to get to work in the front of the shoulder. We'll show you some more in just a minute. We're going to tie these at the very end. That black. Okay, so now we're using this elevator to free up these anterior tissues. I just wanted to give you an idea of how well we can see when we have the camera in the front of the shoulder to do this. We can see all the way down the front. And then once we free this up, we'll be able to reattach it in the proper position on the glenoid. Okay, so here's the first, most inferior anchor end. Notice it's single loaded. I like the position just to give you an overall idea of where we are. You can see that there. We'll show you some more in a minute. Okay, here's our first hook. It's loaded with that shuttle relay that we showed you before. See that? And now we're going to work on placing a plication suture right down here. And that looks good. We'll bring that tip up right where we want it. Okay, so this is the second anchor we're working on. We're going to capture a little bit of the capsule here. And then we'll go back and get underneath the entire labrum. Okay, so what you see me doing here is using a shaver just to clear off about 1 centimeter of the superior labrum, of the cartilage underneath the superior labrum, so that we can reattach this biceps tendon anchor and fix this slap lesion. So you see the shaver working there. If I stop it and pull back, in a minute you'll see how the bone looks kind of yellowish there? That's what we're trying to expose here. And that's the part that I can't do with one of our fancy orthobiologic injections. We've got to expose the bone for this to heal, at least in my opinion, and in my experience. So we're getting there. You can see we've got a little bit more exposed there. Once we get enough, we'll stop and we'll place an anchor right here, and then we'll reattach the biceps tendon down to it. So we'll show you some more in a little bit. Okay, so now we've got enough of the bone exposed. See the yellow? That's bone. The white is the cartilage. And so now that we have enough exposed, that'll give us a place for this anchor to heal to from superior to posterior. So I'm happy with that. And next we're going to go ahead and take a guide. We're going to slip this yellow cannula behind the biceps because I think it gives me a better angle. And then we'll take our guide there's the guide. And this is going to come right in front of the biceps. So basically right in this region right about here. That looks pretty good right about there. So we're going to go ahead and take our anchor down there. Okay, so here you can see this anchor is in. There's 2 sutures from it. There's a couple ways to manipulate the sutures here. I'm going to just take one of the sutures right now out the front here, and then we'll show you some more in just a minute. Okay, so here's the biceps anchor repaired. There's just to the right of the blue cannula is the superior edge of the subscapularis tendon, and here's a little bit of the middle glenohumeral ligament crossing it that's left over, and then down below is our Bankart repair. That looks good. Back of the shoulder looks very tight. Remember, we still have to tie the sutures for the remplissage, and so that's our next step. We're almost done here. Okay, so now we've got the remplissage sutures tied. You can see how that's centered the glenoid underneath the humeral head. The anterior shoulder looks very tight. And even the posterior portal doesn't need to be closed because now that's been covered up because we've used 2 overlapping mattress sutures for the remplissage. So you've got some condylar damage from the recurrent dislocations over all these years and a little bit of labral fraying, but I think all in all, we ought to have you in a good spot to heal this and to hopefully have a stable shoulder going forward. So good luck to you now. Bye-bye.